Good evening, everybody. I want to thank y'all again for coming and joining me again for another one of my lectures. It's really great that like I said this last time, I get to be a nerd in front of you guys and enjoy it, and know you guys enjoy being a nerd with me. So we're going to all get our nerd on again tonight and continue to learn about heart disease for you guys. Now, today's topic is going to be heart disease in cats. 2 weeks ago, I did a heart disease lecture on dogs only. And the reason why I separated it is because cat disease and heart dog disease are both very different. And heart disease in general is a really big subject. I shared it with you guys last time is that I went to a convention last year and spent 10 hours on heart disease just in dogs. And so for us to do cats and dogs in the same lecture would just be too much information and it really wouldn't be very meaningful. So we separated them out. Now, in veterinary medicine, we're always saying that cats are not little dogs. Everybody is tempted to think, let's do what we do for dogs and do it in cats. But they are their very distinct, unique species, and they have a lot of characteristics that are different to them. So for those of you who did attend the dog lecture last week, cat disease is distinctly different. So this is going to be a new talk. Some of the normal things that we talked about with the dogs is going to be kind of a review for you. But the types of heart disease they get and how they present are a bit different in cats, and the way we approach them is a little bit different in cats compared to dogs, okay? Now, just like with the dogs, we're going to start with normal. So before you can understand abnormal, you have to know what the normal is. So this here is a picture of a heart. This one here is in diastole. That's when the ventricles are in relaxation. And this one here is called systole, and that's when the ventricles contract. So we're going to focus here on the left side heart first. Actually, let me get my laser. There we go. Can you see that better? So the left side of the heart, for some reason our convention is the right side of the image is actually our left side. So the right side of the heart is over here in our left, and the left side of the heart is over here in our right. So right up here, the first chamber of the heart is the right atrium. So blood comes from the top of the body and the bottom of the body into fills the left atrium, or I'm sorry, the right atrium. Goes into the right ventricle, and from the right ventricle the blood goes into what's called the pulmonary arteries, which go to the lungs, so the blood becomes aerated and we can expel carbon dioxide. After it goes from the lungs, it comes into the pulmonary veins to the left atrium. From the left atrium it goes to the left ventricle, and then from the left ventricle it goes to the aorta and out to the rest of the body. Okay, so that's the way the blood flows through the heart. But really, the heart is two pumps in one. You have the right side of the heart that receives blood from the body and then pushes blood to the lungs. And then you have the left side of the heart that receives blood from the lungs and then goes to the rest of the body. Now these two pumps work in unison. So both atria contract at the same time and both ventricles contract at the same time. Now, and to ensure that blood flows always in one direction and it goes always very efficiently, we have to have good working parts of the heart. So you have to have good working valves. You have to have good working heart muscle. And you have to have the rhythm at a rate and the way that the heart contracts in a way so that pump gets blood efficiently. Can't have too slow of a heart rate. Can't have too fast of a heart rate. And the heart has to contract in a very specific pattern so that blood can be emptied from the different chambers most completely for you guys. Okay? Any questions so far? Alrighty, great. So if you guys do have questions, just interrupt me. If you guys online, go ahead and submit them online for us, and Katie will let me know that you have questions, and we can answer as you go along. So it'll be kind of informal, interactive kind of a talk as much as you guys need it to be, okay? Now, in cats, they get 5 different types of heart disease, main types of heart disease. There's others with 5 main types, as opposed to dogs, we only had 3 to have to worry about. Cats, they have 5, and these are the different names of the 5 different diseases. The first one is hypertrophic cardiomyopathy, or HCM. Now this is a disease where the heart muscle gets very thick and gusto. So there's a very large heart muscle in this part, okay? Then the next one is called restrictive cardiomyopathy. In this heart disease form, the heart muscle becomes scarred or thickened or very stiff. And that can occur either with the scarring or the thickening occur within the ventricles themselves and the muscle, or it can actually have bridges of scar tissue spanning the chamber of the ventricles so that they can't fill up very well. Now, those 2 are listed first, both because they're the most common, and also they, except for the changes that occurs in the heart muscle themselves, they have fairly similar hemodynamic consequences. They have the same effects on the way that they do or don't pump the blood. So the lion's share of this talk is actually going to be spent on hypertrophic cardiomyopathy. That's the main form of heart disease we see in cats. And so we're going to do the lion's share with those. We're going to have briefly mentions of the other types, so you have at least a working knowledge of what they mean. So if your cat does encounter one of these lesser common forms of heart disease, you know what they're about. Dilated cardiomyopathy is actually the exact opposite of hypertrophic cardiomyopathy. Hypertrophic, again, is where the heart muscle gets big, thick, and strong. Dilated cardiomyopathy, the heart muscle gets very weak and thin and doesn't have the strength to contract very efficiently for us, okay? Dilated cardiomyopathy right now in cats is very rare. Back before 1992, we did not realize that cats required taurine in their diet. They can't make it on their own. Dogs can, but the cats can't, so they needed taurine in their diet. So whenever the cat and dog food companies didn't realize that, a lot of cats were getting dilated cardiomyopathy. We found out it was due to this taurine deficiency. Now, since 1992, all the cat food companies put taurine in their food, so we rarely see dilated cardiomyopathy any further. Then we have one called arrhythmogenic cardiomyopathy. Now this has two forms, that's why I have two different abbreviations. One is arrhythmogenic right ventricular cardiomyopathy, we'll spend a little bit more time on it. And the other one is called arrhythmogenic right ventricular dysplasia, where the right ventricle is abnormally formed or developed, okay? They both kind of go hand in hand because they both have, usually go on at the same time in most cats when they're present. Now, cats being cats like to do things their own way. They actually also have what's called a non-specific cardiomyopathy. We used to call it unclassified cardiomyopathy. And these are cats that have heart changes that don't fit into any of the other categories, because cats are cats. Okay? All right, now just get a little bit of a better feel of what this all means. Up here on the upper left diagram, there's 4 hearts here. On the upper left diagram is a normal heart. So you can see that the heart muscle thickness is pretty uniform throughout both ventricles. Okay. In hypertrophic cardiomyopathy, you can see that the heart ventricle, the muscle itself gets very, very thick and large. Okay. And it does happen in the right ventricle somewhat, but it's mostly the left ventricle that's involved. Now that sounds like it's a good thing. You got a big, strong heart muscle, so it should be really strong to pump blood. But what happens is that big muscle now takes up space from the ventricle space itself, so it can't fill up very well. Okay. This is called diastolic dysfunction. Diastolic is the time where the heart is supposed to be relaxed so that it can fill up with blood. Here it can't fill up with blood very well because there's so much heart muscle there, the chamber is actually much smaller. So it's a defect whenever the heart should be filling. That's why we call it diastolic dysfunction for these guys, okay? Now, restrictive cardiomyopathy is where the ventricle becomes very stiff, either because of scar tissue in the muscles itself, or you can actually have bridges of scarring going across the ventricle so it can't fill up and expand very well. So again, you have the same kind of effect as if you had a big heart muscle where it just can't fill and expand very well, so you have some diastolic dysfunction. It can also be very stiff where it doesn't contract very well either, so you can't squeeze the blood out of the ventricle very well, and that's called a systolic dysfunction. So the restrictive cardiomyopathy does have a little bit of a different dynamic to it. Now up here, called dilated cardiomyopathy, the heart muscle becomes very weak and thin and flabby, and then the heart muscle gets really dilated because it just can't hold the blood very well, nor does it have the strength to empty the ventricle. So this also is called a systolic dysfunction. Again, in cats, that's pretty rare, okay? Any questions about the types of heart disease that we see in cats so far? Okay, good. I'm not going too fast for anybody just yet. Wonderful, wonderful. All right, now just to go a little bit more detail with hypertrophic cardiomyopathy and how it progresses over time. So again, in this heart, you've got the normal heart here. It's a little bit of a better picture in this one here where you can see the heart muscle a little bit better. You can see the left atrium very well. You can see the valve that keeps the blood going from the left atrium to the left ventricle only in one direction. So when this squeezes, that valve closes and then it squeezes blood into the aorta. Now for the hypertrophic cardiomyopathy, you can see that the heart muscle gets very, very thick. So if you look and compare, look how much space there is for blood to fill up in this ventricle as opposed to this one over here, okay? So since the blood cannot fill the ventricle completely, there's just not enough space there for it to happen, blood backs up into the left atrium. Look at the size of the normal atrium compared to one that is now backing up with blood because it can't empty all the way because the ventricle can't hold as much blood. Now over time, that atrium gets bigger and bigger, and then the pressure backs up into the pulmonary veins, which are coming from the lungs, so they get dilated. And then as pressure builds up even further, then fluid starts to leak out into the lungs themselves. Now, this can also happen on the right side of the heart. Remember, there's two pumps with the heart, one from the left and one from the right. So if this happens on the right side of the heart, blood backs up into the right atrium, which backs up into the veins that come from the body. And then if that backs up further, then we get fluid building up in the body cavities, around the lungs, in the abdomen, freely in the abdomen as well. So we can have that kind of things develop. Now, based on this progression, we have kind of categorized heart disease into different stages. Now, in cats, we also have a little bit of a nuance that we don't see in dogs very often, and is that because of the left atrium gets so large, blood just kind of sits there. It doesn't empty very well, and it keeps getting filled up from the veins, and it doesn't fill very well because there's extra pressure there. So blood stagnates. And when blood stagnates, it tends to clot. So these cats are prone to forming clots that can then leave the heart and lodge in arteries over the body. We call that arterial thrombal embolism, or ATE. Now, the most common place for this to occur is in the arteries that go to both back legs together. The aorta that leaves the heart, it actually travels through the body in one large vessel that goes all the way down until it gets to the back legs. Now, there's branches along the way that goes to the different parts of the body, but the last branching is those to the back legs. So right at that bifurcation, the clot lodges, and all of a sudden there's blood flow, no blood flow to both back legs at one time. So you get a sudden paralysis with those back legs. So this is a unique feature to cats that we don't tend to see in dogs very much. Now, based on this progression, we now categorize heart disease like we do in dogs in 4 different stages. Stage A is whenever the cat is actually having a normal heart, but they are prone to heart disease. There's a lot of breeds, especially things like the Ragdoll, the Maine Coon, the Berman, Siamese, exotic breeds. These guys are prone to having heart disease, so they're automatically in stage A heart disease, even if their hearts are completely normal. Stage B is where there are structural changes to the heart, but they're not that severe. So there's a low risk of them going into congestive heart failure, having fluid building up in the lungs or in the body cavities. And they're low risk of having these clots form, so low risk for the arterial thrombal embolism. Now, these cats, both stage A and stage B are asymptomatic. Okay. Then you got stage C, where you have active congestive heart failure, so fluid is building up in the lungs and or the body cavities. Or you have an arterial thromboembolic event. They have a sudden paralysis or a clot that have lodged somewhere. Now, most of the time that clot is going to be into both back legs, but it can occur just in one back leg. It can occur in one of the front legs. It can occur in other places as well, like the GI tract, the brain, the kidneys, but all those locations are much less likely. And the reason is the most direct path for a clot to take is directly through the aorta until it has that last bend at the end. It's like you're going down the road, you got all these turnoffs, a little harder to make turnoffs, but you get right to the end and you have no choice. You got to go one way or the other. Same kind of thing with clots whenever they occur in the body. That's why it's most commonly affecting the back legs, not other places, but it can go to other places for these guys. And then stage D is whenever they're in congestive heart failure, but they're not responding to the traditional therapies and keeping them out of congestive heart failure, or they have multiple bouts of arterial thrombal embolism, so that's stage D. So that goes to increasing severity based on how we know heart disease progresses in the last slide that I just reviewed with you, okay? Now, stage B is a very nebulous stage, and it gets to the point where I actually have a cringe whenever I hear a heart murmur in cats, because identifying cats that are in stage B heart disease, remember, these cats are asymptomatic, can be a challenge. And it's a challenge for many reasons. First, about 30 to 45% of cats without heart disease can have a heart murmur. You hear a murmur, but the hearts are fine. Okay? So a murmur does not mean heart disease. In dogs, that's the opposite. You have a heart murmur, there are structural changes with that heart, so they do have heart disease. They just may not be symptomatic. But cats can have a murmur, have no heart disease. Conditions that can trigger murmurs without heart disease being present include high thyroid disorders, high blood pressure, anemia, stress. We can have also what's called physiologic flow murmurs, which means that the heart structure is normal, but just because of the way the blood flows through the heart, it creates a soft murmur. And even if the veterinarian is a little bit nervous or cat's a little bit fractious, you can put a little bit of pressure on the stethoscope and push on the chest, you can actually trigger a murmur because cats' chests are very pliable. You can indent them pretty easily. So even an inappropriate technique can trigger a soft murmur in these guys. So there's a lot of reasons why normal hearts can still have murmurs associated with them. So that's one thing that confuses us. Another is even if there's heart disease present, anywhere from 20% or greater, and I've heard some cardiologists say it's 50% of their cats with heart disease don't have murmurs. So the absence of a murmur doesn't mean that the cat does not have heart disease. So again, another confusing thing for us to how to discern, is this cat in stage B, asymptomatic heart disease? And then progressive cardiomyopathy or heart disease in cats is extremely variable. There are some cats that live with a soft murmur for years and it never progresses and they never have changed. Other cats, though, they can go from a soft murmur and within a matter of months to a year, they're already in stage D heart disease where they have a very refractory, very severe decline. So it's extremely variable in how it progresses over time from case to case in cats. So why do I spend this time saying, why do we want to identify cats that are in stage B heart disease? And the reason is stage B is subclassified into stage B1 and stage B2. Stage B1 means that the changes of the heart are mild. You can still hear a murmur though. And because they're mild, the cat is in low risk for developing congestive heart failure, fluid building up in the lungs or the body, and there's a low risk for them to form clots to the body, okay? However, in stage B2, whenever there's more advanced changes, like a very large left atrium or some left atrial systolic dysfunction, which means it doesn't contract very well, or if you have left ventricular systolic dysfunction, where in addition to not being able to feel well, it's also not emptying very well. You can have the beginnings of what's called spontaneous echogenic contrast, or SEC, in the atrium. That's a cloudiness, a wispy cloudiness that starts to be seen on an echocardiogram that is a precursor to a clot to form. And you can actually see actual clots in the left atrium, even though the cats are asymptomatic and have not yet thrown a clot somewhere else in the body. So if all these things, or any of these things are present, these cats are now at high risk of congestive heart failure or forming an arterial thromboembolic event, okay? And these cats, sometimes we might need to treat, okay? So that's the reason why we should identify cats with stage B heart disease, because if we find them to be stage B2 heart disease, there are medicines we may want to get them on to either prevent clots from getting too bad, or if they have an arrhythmia, to treat for the arrhythmia that's there and things like that. So there's things that we may need to do even though they are asymptomatic. Unfortunately, the only way to tell the difference between stage B1 and stage B2, since the cats are asymptomatic and murmurs are not a good indication of heart disease, is with an echocardiogram. So that being said, should we be doing echocardiograms on all the animals that we saw, on all the cats that we see, especially if they're older? Well, in the real ideal world, yeah. You know, like when we go to the doctors, you're healthy, but they're going to be doing blood work. They're going to say, let's get your echocardiogram, let's get your thyroid checks, let's get your blood pressure check. You're going to do studies on you, even though you're asymptomatic, just to be sure there's not something subtle that's not yet symptomatic being present, so they can intervene early. But that's not practical for doing a $500 to $600 test on every cat that we see, whether or not there's a murmur there, just because they're in the middle age to older years, okay? So practically, what we end up doing is like to perform echocardiograms for those cases that are going to be more at high risk for developing heart disease that's significant. So those include those that are certain breeds. Like I said, a lot of the pure breeds, like the Maine Coon, the Ragdoll, the British Shorthair, the Burman, Norwegian Forest Cat, Sphinx cats, these are all breeds that are prone to having heart disease. So whenever they start to get older, especially if they have a murmur, we should be doing echocardiograms for them. Now, unlike in people, that they've actually mapped out very clear genetic causes for heart disease, and cats we've not really delineated them very well, but in both the Maine Coon and also the Ragdoll, we have identified a genetic mutation. So if somebody does a genetic screening on either of these breeds and they show positive for the genetic mutation, these cats we should also do echocardiograms on, even if they're asymptomatic. Now, if there is some abnormal heart sounds, there is what's called a gallop rhythm sometimes happen. What a gallop rhythm means is that when the heart goes through its beating cycle, we hear 2 heart sounds most of the time, but there are actually 4 heart sounds. And we just can't hear with our ears 2 of those 4. So normally when we hear a heartbeat, we're here, da-dum, 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 2 beats, da-dum, da-dum, da-dum. If there's a gallop rhythm, you're now hearing one of the other 2 heart sounds. So you hear la-da-dum, 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 or da-da-dum, da-da-dum, da-dum. So it sounds like a horse galloping, thus the name. Now that is an indicator that the heart's getting really stiff, like it might be getting thicker. And so that's one that it gives a concern that we have heart disease present. Or if there's an abnormal rhythm itself, not just a gallop rhythm, but instead of da-dum, 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 we're in da-dum, 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 dum, 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 da-dum, da-dum. So we're hearing a very irregular rhythm that increases the risk that this cat does indeed have asymptomatic cardiomyopathy, okay? If we do radiographs for any reason, we find that the heart's getting bigger, even incrementally in cats. It can also be an indication to do an echocardiogram. However, radiographs don't really have a strong correlation to severity of heart disease because their heart just gets thicker, not always bigger on the radiograph. So that's why you need an echocardiogram that can see the internal structure of the heart to identify whenever they're actually in cardiomyopathy. So you don't want to rely that a cat has normal heart size on the radiograph that they don't have heart disease, okay? Any cat that's older, that whether they're murmur or not, that is going to undergo a procedure that is going to be higher risk if they do have heart disease, like anesthesia, have to have them on IV fluids that are on high rates, or you have to give them long-acting steroids for some reason. These animals are more likely to go into congestive heart failure in those situations, even if they have asymptomatic heart disease. And lastly, if they have an increase in a blood marker for a heart disease called the NT-proBNP. Now, NT-proBNP, I mentioned that last because it is something that we can do on an easy basis to get a blood sample drawn and screen for heart disease. But the test is not all that cut out for. Cardiologists actually rarely reach for the NT-proBNP because, honestly, an echocardiogram, which is a better test. The NT-proBNP says that if it is low, there's unlikely to be heart disease. If it's high, there's likely to be heart disease present. But it's not specific enough for us to make the call just with the value alone, okay? NT-proB stands for N-terminal, the amino acid terminal of what's called the pro-B-type natriuretic peptide, okay? That's where we get the abbreviation NT-proBNP. There's also a C-proBNP, which is the carboxyl terminal, it's the other end of the molecule, but that degrades so quickly that it's hard to measure. The N-terminal tends to stick around in the blood a little bit longer, so we can measure it a little bit more easily. When the heart starts to go into hypertrophic cardiomyopathy, the heart muscle starts to stretch. And whenever the heart muscle starts to stretch, that's whenever the heart secretes this, the natriuretic peptide, so that it can the body loses sodium and loses some water with it, and then the heart doesn't stretch. Now, in a normal situation, that's good. But whenever there's a heart not working very well, whenever they start to lose have that loss of sodium and the loss of blood volume, that's not always a good thing. But whenever we see the increase in NT-proBNP, then we say, okay, now we might have some heart stretching going on, and then we have to be concerned about heart disease. But it's a very specific test, which means if it's positive, you really should look into it. But it's not a very sensitive test, which means that you can have a lot of cats with subtle heart disease that you're going to have perfectly normal NT-proBNPs, or they're going to be in the gray zone. So it's not, in my mind, a great screening test to say I don't have heart disease. It's going to be a situation where I want to distinguish between, does this cat have either no heart disease or just not very significant heart disease, or is it maybe more advanced heart disease? So it's not a good indicator for early heart disease, it's a better indicator for more advanced heart disease. So it's not always a first line test that we reach for. It doesn't stay steady either. There's a lot of day-by-day fluctuations. Most of the time it's less than 10%, but there's some cats that can vary as much as 50% per day. So that means that the level of the NT-proBNP measurement over time, if it looks like it's getting worse, doesn't always necessarily mean it is getting worse. Also, there's a lot of conditions that are not heart-based that will cause us to elevate, like high thyroid. We can have high blood pressure do it. We can have a hormonal balance called acromegaly do it. We can have a lot of stressors do it. The NT-proB is cleared by the kidneys, so if the kidneys are not working very well, it'll elevate as well. So there's a lot of false positive potential with the NT-proBNP. And there's not a cutoff, it's not positive and negative with the ranges. We have a range. If it's less than 100, then it's heart disease is unlikely. But if it's between 100 and 270, there's a gray zone. There may or may not be heart disease there. So you have to interpret that one with a lot more caution. And then if it's over 270, then you're likely to have heart disease. if you don't have acromegaly or high blood pressure or hyperthyroidism or the kidneys are not working very well. So you have to have a lot of conditions to say, okay, this elevation is likely due to cardiac reasons or not. And then once you get that result, then you do your echocardiogram to see, is there heart disease? So even though it sounds like a nice, easy test, well, let's do a blood test for the NT-proBNP to see if my cat has heart disease, there's limitations with it. So if we use it, the setting that is usually most useful is if you have a cat coming in that has a murmur and has difficulty breathing, and you're not sure, is this respiratory disease and it just happens to have a physiologic murmur, or is this heart failure? You can run this test, and if it is high, it's likely those signs are from heart failure, not due to a respiratory disease. That's whenever this test has its most utility. But if you're going to a specialty center, they usually have the means to do an echocardiogram, which will trump the NT-proBNP test. So it's only if you don't have echocardiography available readily that this test has have a little bit more meaning, okay? Alrighty. Now, one thing that I do want to start mentioning again, I mentioned this at the dog lecture, is having animals with heart murmurs that may be in stage B2 heart disease to start measuring the resting respiratory rates. When animals enter into stage C heart disease, when they're in heart failure, and since the lungs fill up with fluid, the first thing that the body does is start to breathe faster so they can get more oxygen into the lungs. So they're going to be an increase in the resting respiratory rate. As it gets worse, then they become lethargic, then they have difficulty breathing and things like that. So the first change is an increase in the resting respiratory rate. So if you're going to measure this, you want to measure how many times the cat breathes per minute. Now, a minute can be a long time, so you can do it for like 15 seconds and multiply by 4, or 30 seconds and multiply by 2, whichever you like to do math. You could do it by 5 seconds and multiply by 12, however you like to do your math, or a couple of different ways. Now, when you're counting the breaths, you want to count inspiration and expiration as one breath. So in, out, 1, in, out, 2. And what we want is we want that number to be less than 30 breaths per minute when they're at rest. That's the other key. They have to be at rest, not right after they've been running around getting excited. They have to be resting or sleeping whenever you measure the respiratory rate. A lot of cats will end up stabilizing in the high teens, 16, 17, 18. But if you start seeing them trend upwards on a consistent basis, that's when you have to be worried. So they're 18 one day, 2 days later they're at 20, 2 days later at 24, 2 days later at 28. They're not at 30 yet, but they're trending pretty consistently that way. Now this can fluctuate depending on what you measure. So if you get 18 and then 24, don't get excited. Measure again a few hours and it goes back down to 20, then that was just a transient fluctuation. So don't panic with a one-time measurement. You want to look at trends over time, or if it's consistently above 30 breaths per minute. Then even if they're asymptomatic in every other way, they should be evaluated for the possibility of congestive heart failure. There's a lot of apps that are out there. One of them that they do recommend the cardiologist is called My Pet's Heart to Heart, but there's other ones out there that can actually help you measure this. It can keep track on it. They have graphs for you. They have ways that you can count out how many breaths per minute and things like that. So it's a really helpful tool that you can use to, instead of just doing it on your own or logging it in a notebook or something like that. Okay. Now, once the cats go from stage B to stage C heart disease, again, that's whenever they have current or previous congestive heart failure or arterial thromboembolism, or the ATE. Now, in congestive heart failure, you're going to have fluid accumulating because of backup pressure from the heart. Now, if it's on the left side of the heart, since the left side of the heart receives blood from the lungs, it's going to be the lungs that fills up with fluid. If it's the right side of the heart that's failing, then you can have the body cavities fill with fluid because the right side of the heart receives blood from the body itself, okay? Now, if it's in the lungs, we call that pulmonary edema. Fluid in the lungs is called pulmonary edema. If we see free fluid in the body cavities, that's called effusions. And where that effusion is detects the name. If it's in the around the chest, around the lungs, that's called the pleural cavity, so we'll call that pleural effusion. If it's in the abdominal cavity, that's the peritoneal cavity, so we call that a peritoneal effusion. There's also a third cavity called the pericardial cavity, but in cats it's not common for them to fill that cavity with blood. Dogs they can, not very common in cats. So that's another place it can accumulate, but in cats I didn't mention it because it's not very common. Now, arterial thromboembolism is where we talked about the clots form in the heart, and then they leave the heart and they can lodge at some of the arteries in the body, with the back legs being the most common, and both back legs at the same time is the most common place that happens. Although you can have one back leg affected, or sometimes a front limb, or other parts of the body like intestines, kidneys, or brain also affected, but those are much less common. Usually it's both back legs all at one time, okay? Alrighty. Now, what are the symptoms that you're going to see with congestive heart failure? Now, it depends on what presenting sign you're going to, or what form it takes. If it's congestive heart failure, we talked about increasing respiratory rates, lethargy, hiding, decreased appetite because you're just not feeling good. These are vague signs. Anything causes these signs, not just heart disease for us. We can also have not just the increased respiratory rate, but also an increased respiratory effort, so they have more force to their breathing. They're having bigger exertions to try to get the breath in and out of the body. They have what's called exercise intolerance. That means they don't have to exert much energy before they have to stop and catch their breath. So, before they used to run around the house, now they go up 2, 3, 4 stairs and they're stopping and they're huffing and puffing to try to catch their breath. That's called exercise intolerance. Now, if it's the arterial thromboembolism, there's a sudden either weakness called paresis or actually true paralysis, a true loss of all function to the limbs that are affected. Again, most commonly both back legs at the same time. Now, if the cats also have an arrhythmia, which is not the criteria for stage C heart disease, you can have arrhythmias in stage B heart disease, because stage C is defined by congestive heart failure or arterial thromboembolism. They can have arrhythmias. If there's arrhythmias that are bad enough, cats can faint, okay? And in some, unfortunately, some cases, you have no clue that there's heart disease and they just pass away unexpectedly, very, very suddenly. So that is a possibility with these guys. Now, one thing that I want to have you guys note is one sign that we talked about in the dogs that we don't see in cats very often at all is coughing associated with heart disease. We see a coughing cat, we don't tend to think heart disease. We think lower airway disease, okay? And this brings me up to one of my pet peeves that I have with people. And the pet peeve is actually not with people, but the old wives that are out there to make up all these stories and everybody believes, the old wives' tales. One of them is a common saying that says that cats cough up fur balls, right, or cough up hair balls. They don't. They vomit up fur balls, okay? And if you think about it, it makes sense. You're not going to have this big, huge wad of fur in the trachea or in the airway that they have to cough out, because if they had that big of a wad of fur in the trachea, they'd asphyxiate and they wouldn't be alive any longer. So it's going to be something they vomit up. But it is a very common saying, and because it's so common, people get very confused. What is the difference between coughing and vomiting? Now, for me as a veterinarian, it's a very important distinction because it very much depends where I go next with my diagnostic tests or my treatment therapies, because respiratory disease is a very different set of tests and treatments than GI disease. So I have to be really sure, what do you mean when you say coughing up a fur ball, And so I will spend just a minute talking about the difference between coughing and vomiting, okay? Now, coughing, the cats tend to crouch down low. They get their neck extended a little bit so they can expel whatever's in their airways a little bit easier. And then they have just basically a forceful exhalation, very similar to what we do whenever we cough. Now, most of the time, cats, when they cough, it's not productive. But every once in a while, I get a little bit of a white phlegm or foam that is brought up for these guys, okay? Now, vomiting is very different. Vomiting is actually a process because it's a reflex that develops from mild to severe. So they start with a nausea feeling. And whenever they're doing that, they usually lick their lips or salivate and drool a little bit. They feel a little bit off. Some cats will actually vocalize a very deep meow type of a vocalization. And then whenever they go to empty the stomach, they do active retching for a few moments, and they actually have a forceful expulsion of whatever's in the stomach, a forceful emptying of what's in the stomach for you guys, okay? Now, hopefully this part works, because I've actually got a few videos here, so hopefully... see here. That's not it. There we go. And see if this works. Can you guys see that? Of course not.
20% off at Chewy Pharmacy.
Okay, that works,
These
but it's
days,
not showing
we
the
get
video.
everything
Oh,
delivered.
I wonder if it opened in a different window on your computer, Dr. Mike.
it did. But it should still follow that. Maybe I have to... do I have to get out of this first for that to show? Oh, man. It's not working. And now I got out of my whole thing altogether. Let's try this again. Okay, there we go. Got that back up. Okay. Sorry guys, my videos aren't working. It worked last time I did this, but now it's not something to work again.
Yeah, last time you did do it, you had stuff embedded in.
Right.
And it worked.
Yeah. Maybe it's because it's going to YouTube, but it's not going to the YouTube. I'm sorry guys. So hopefully from what I just described, you can get a clear idea of the difference in coughing and vomiting. So hopefully from now on, none of you guys that are watching either online or here are going to come to you say, my cat's coughing up a fur ball. I have to see what's going on with that. So if it's coughing, again, we think lower airway disease. If it is vomiting, then we think the GI disease. But in any case, coughing is not a sign of heart disease in these guys for you guys. Okay? Alrighty, let's see here. All right, now, how do we diagnose stage C heart disease? Now, we talked about the symptoms you guys are going to notice at home or that we notice on the exam. Now, if we are having left-sided heart failure, that's where the fluid builds up in the lungs, we have the pulmonary edema, radiographs are the best way to identify that in cats, okay? Now, a lot of cats are so unstable and they have such difficulty breathing that just holding them down to take the x-rays can be very stressful and risky, and that can cause further decompensation, so we need to stabilize them first. But in cats, when we do radiographs, it's not always a very straightforward set of signs that we see. Dogs have a very characteristic pattern whenever they go into congestive heart failure. You can see an obvious left atrium that's big, you can see big dilated pulmonary veins, you can see a lot of fluid, usually in the what's called caudodorsal lung fields. Those are up in the top back area of the lungs. That's our typical heart disease. Cats, they can show anything. You don't see a heart enlargement. Their veins may or may not be enlarged, or arteries may or not be enlarged, and they have a patchy pattern throughout their lungs. And that can also be present whenever there is lower airway infectious disease, like viral bronchitis or pneumonias. Bacterial pneumonias can do that if it's a patchy pneumonia pattern. Trauma to the lungs could do that. Neurogenic pulmonary edema can do something like that. Bleeding disorders can do things like that. Even cancers can show up with those kind of infiltrates. So even if we do radiographs, and that's the best test for us to use to see, is this congestive heart failure or is there fluid in the lungs, interpreting it would be challenging. And even with my 30 years experience, not too long ago I had a cat that had a heart murmur, had its known heart disease, that was also exposed to other cats with upper respiratory tract infection, was doing a lot of heavy breathing, and I took the radiographs, and I says, I could explain it both ways. I can't say for sure. I actually had to get a cardiologist to look at the radiographs and help me interpret, is this infectious lower airway disease or is this truly congestive heart failure? So it's not always an easy thing, and sometimes reaching for specialists would be something that would be necessary in order to distinguish between pulmonary edema patterns versus other types of lung patterns that we see, okay? Now, if you have the right side of the heart that's failing, that's where you get free fluid accumulating in the body cavities, around the lungs in the pleural cavity or around the intestines in the abdomen. Now, usually we can see these with x-rays, although you don't see a lot of detail with x-rays because fluid and soft tissue have the same level of gray on the radiographs. You see big white out everywhere. So you can confirm it with radiographs. You can also see it with an ultrasound very quickly, a focus ultrasound. And that's actually a little bit nicer because, again, radiographs are stressed for cats, and with very minimal restraint, you can just put an ultrasound probe on their chest or the abdomen to see is there fluid there. Now, even if we see fluid with a heart murmur, like we're seeing with the radiographs, a lot of other diseases besides heart disease cause fluid to build up, including things like cancers, infectious diseases like bacterial or FIP or fungal types of infections, trauma, foreign body, systemic inflammatory diseases can do that, low protein syndromes can do it, internal bleeding can do it. So there's a lot of other things that will cause fluid to build up than congestive heart failure. And so once we identify the failure there, we stabilize the cats, a lot of times we'll need other tests to kind of help to distinguish, is this from congestive heart failure or is there another reason for there to be fluid building up in these body cavities? And then if we do have the cat show as arterial thromboembolism or ATE, we call it the 5 Ps that are designated or typically go along with any arterial thromboembolism. So it's very painful whenever there's this loss of blood flow all of a sudden. There's also sudden weakness or paralysis, so that's the second P. You can have pulselessness, which means you go to feel for a pulse and don't feel it because now there's an occlusion to that artery. And in cats, their arteries are small to begin with, so the only pulse that you can really feel is what's called the femoral pulse. That's the main artery that comes down into the leg at the top of the thigh, on the inside of the thigh. Anything further down is kind of hard to feel in cats, but if you go to feel for them, you can't feel them. That's another sign for that. Pallor, which means that pads, which are normally pink in the non-pigmented pads, are now pale or blue or gray in color. And you also have what's called polar, which means they're cold. The extremities feel cold. So if you have the 5 Ps in a suddenly down cat, They don't have to worry about arterial thromboembolism. You can confirm this with an ultrasound. You can put an ultrasound probe and take a look at the aorta in the abdomen and see a big clot as it branches into the back legs. You don't always need that to make the diagnosis though, but that's just one of the little other tests that we sometimes reach for if we're not sure, or if the pulses feel a little bit off and we think there might be a partial obstruction from a clot to see what's going on for these guys, okay? Now, remember, stage C heart disease is characterized by congestive heart failure or arterial thromboembolism, but there's other concerns that we can have as well. One is arrhythmias, we talked about, where the heart rhythm is irregular, and because it's irregular, it cannot efficiently pump blood very well. There's a lot of different types of abnormal rhythms that can develop. You can usually hear them with a stethoscope, but to diagnose what particular arrhythmia is present and what kind of medicines we need an ECG to diagnose that. And there's another condition called dynamic left ventricular outflow tract obstruction. Okay, we like these long names in cardiology. Now, what happens there, and I'm going to show you a picture, is in hypertrophic cardiomyopathy, we have a heart here in diastole, or relaxation of the ventricle, so the ventricle is trying to fill, and here it is in systole, or it's trying to contract. In left ventricular outflow tract obstruction, what happens is in the resting mode, you can see the mitral valve. There's two leaflets to the mitral valve, okay? And in this case, it's nice and open. When this ventricle contracts, the edges should come together and close, and then blood should flow up into the aorta. But what happens is this leaflet, is called the anterior leaflet of the mitral valve, starts to bulge towards the middle part of the heart, and it narrows that outflow tracts. Now, this only happens when the heart is contracting, so it's dynamic. It's not always present. And it's the outflow tract of the ventricle, the left ventricular outflow tract, that now is obstructed by the anterior leaflet. It's called systolic anterior motion of the mitral leaflet, is what we call that. That also can only be diagnosed with echocardiography. But if this is present, it changes how we approach it medically and where we need to go for you with it. So this is something we also have to do with echocardiogram, and they can't tell it any other way if this is present or not, to see what kind of medicines if we need to do. Now, this doesn't always happen just in stage C heart disease. The arrhythmias and left ventricular outflow tract obstructions can also occur in stage B heart disease and in both stage B1 and B2 heart disease, okay? So this is not always an end stage process or change, but it's a secondary condition that we commonly do see with cats with heart disease. All right. Now, treatment, once we diagnose stage C heart disease, what do we do? And it depends on what form of the presentation it is. Now, if it is congestive heart failure, we divide treatments into the acute phase, which is the emergency setting treatment, and then the chronic phase, which means once we get them stabilized and you get them home, what do we do when you get them home? Now, when they're initially in the acute crisis, they're having difficulty breathing, so we have to give them oxygen. They're usually very anxious and upset because it's a very stressful thing to not be able to breathe, so we give them some sedations to calm them down, and that actually does a lot to improve their ability to breathe a little easier as well, just by sedating. They take that anxiety down a little bit. And then we give them a medicine called furosemide. This is a diuretic. It basically dehydrates the body and it draws water out of the lungs. And then if there's fluid building up around the lungs, and the abdomen is not as compromising, but if there's fluids around the lungs, that fluid then collapses the lungs, so they can't fill properly either. So in order to fill those lungs back up again, we have to drain the fluid from around the lungs. It's called a thoracocentesis. Very simple procedure, just insert a needle between the ribs, which cats actually tolerate quite well, and then just pump the fluid off the lungs until you get them all out of the lungs. I've actually had cats that have been in failure for sometimes hours or a day, and I do this thoracocentesis and they actually fall asleep in the middle of the procedure because now they can breathe easier, but they're so exhausted from trying to breathe for so long, they now can fall asleep. So it's really a very well tolerated. Sounds like an aggressive procedure, but it's actually minimally invasive. It's simple to do, and you can have a profound improvement in their stability just in a short period of time. Now, once we get them stable, the heart is still prone to going into congestive heart failure again. So we try to give them medications to keep that from happening. Like dogs, heart disease is multifactorial in cats, but cats being cats don't tolerate a lot of medicines. With dogs, if you were attending the lecture, we get them on 3 to 4 different medications right from the get-go. Can't do that to cats. I don't like doing that to the owners. Cats don't like that, and you can only limit. So we kind of prioritize what can we get into the cat and what is most important. And of those, the diuretic is the most important one, okay? Now, if we find on the echocardiogram that there is a big left atrium, or we have some of this spontaneous echogenic contrast or smoke that is precursors to clots, sometimes we'll do what's called thromboprophylaxis. That means trying to prevent clots from forming. And a real nice medicine we use is clopidogrel. And there's other ones we can use as well. Now, one medicine that we talked about in dogs called pimobendan, we tend not to use very often in cats. And I usually leave it up to the cardiologist to decide whether to use pimobendan. And the reason is pimobendan, one of the actions it has is to strengthen the heartbeat, okay? Remember, cats with hypertrophic cardiomyopathy already have a big, huge, strong heart. They don't need more force to be able to push that blood out of the heart. They need to be able to relax it even better. So there's a potential for the heart disease to worsen with pimobendan rather than improve. So if you were here for the dog lecture, if you have a dog that has heart disease and you put them on pimobendan, it's not usually our first go-tos in cats. If it's more advanced, or if we find what's called systolic dysfunction in the cats, where the heart muscle doesn't beat very strongly, then sometimes we can use it, but it's not a go-to first-line drug like it is in the dogs for us, okay? Alrighty. Any questions about anything so far for you guys? Okay, good. All right, now if we have a blood clot that has formed, then we actually don't, we have a much different approach. Now, unfortunately, sometimes cats present with both at the same time. Congestive heart failure and arterial thromboembolism have to do both. Now, for arterial thromboembolism, the biggest thing we want to do is keep them comfortable. The first sign that we have this is pain, and it's very, very painful. We need morphine or something as potent or more potent than morphine to keep them comfortable. It's not just a little bit of aspirin and they're going to be okay. This is a very painful thing. And then we want to use what's called anticoagulation, things that keep clots from continuing to form. And so we get them on things like clopidogrel we talked about. There's other medicines we can use like aspirin. You can actually use aspirin in cats, but at very low doses. Usually about a quarter to a half of a baby aspirin every 2 to 3 days is what you tend to use. Heparin, or a new class of medicines called factor 10A inhibitors. There's a lot of different clotting factors that after we get the places to form a plug that form the fibrin clot that keeps it strong. Factor 10A is one of the critical ones that forms that fibrin clot. So we have actually medicines that will inhibit that clotting cascade, so we can also prevent the clots from forming in those regions. Most of the time we reach for clopidogrel. And again, the goal is not breaking down the clots there, it's keeping the clot from getting bigger or more clots to form. And now, it does make it attractive to, okay, let's do something that take that clot down. And there are what's called thrombolytics, drugs that actually break down the clots. One is called tissue plasminogen activator. But we don't use those very often. And the reason is, whenever the clot forms into the artery and then the blood supply is cut off to a certain body part, the tissues there start to go through a hypoxic damage, they start to degenerate and they start to die away. And that builds up a lot of intracellular type of leakage, and we also have a lot of inflammation that is triggered by that. So whenever you get sudden reperfusion of that area, now all that junk that is just leaked out of the cells and are dying away goes into the body. So we get high potassium, we get acidosis, we get arrhythmias, we get sudden systemic inflammation going on, and they can rapidly decline. So even though it seems attractive, let's go ahead and break down that clot. If we break it down too fast, it can have some dire consequences. And also, in order to break it down, you really have to start giving these very quickly, usually within 6 hours of the event, which is a tough window to accomplish for these guys. So even though it is an option, it's usually used at higher referrals of facilities where you see it right away, and they have the ability to really monitor these pets very closely so they don't decompensate, because of the reperfusion injury can be very serious with these guys. And then there's another procedure that they do, and people sometimes call it a thrombectomy, which you surgically go in with a scope or something like that and just remove the clot. Don't recommend it. Don't do it. It's very, very, very high risk, and most cats don't survive it. Okay. Alrighty, now, what do we do once we get them stabilized for follow-up and prognosis? Now, progression from the stage B, where they're asymptomatic, all the way to refractory or recurrent thromboembolism, stage D, is extremely variable. Some cats stay in stage B or early stage C for a long period of time before they progress. Some, they decline from all those stages within a matter of months to a year, okay? So it can be very, very variable on how it goes. It's hard to predict how they go. So as a result, we have to do frequent rechecks to make sure that they are staying stable, that they're not declining too quickly, that we're not having adverse effects in other parts of the body, such as kidneys that start to decline because of the diuretic, can be hard on the kidneys and things like that. If they have arrhythmias, we might do ECGs, doing serial echocardiograms. So there's a lot of intense monitoring that we do for these guys. And the interval of the monitoring is variable, it's case by case, because the progression of the heart disease is extremely variable from one individual to another, okay? Now, we talked about measuring the resting respiratory rates in stage B2, if we're getting identifying at that point. Once you enter into stage C, you want to increase the frequency of doing that. So in stage B2, you're doing it maybe once or twice a week. In stage C, you got to do it daily, if not more often, because these guys can decompensate again once they're in stage C. Once you're in stage C, you're always in stage C. Even if they're stabilized, you don't backtrack to stage B. You never go back to stage B. They stay in stage C. And the heart disease, unfortunately, still does tend to worsen, and eventually they're going to enter into stage D. Now, if they got the arterial thromboembolism, this is a pretty dire consequence of heart disease in cats. In specialty centers, the university hospitals, though they have all these bells and whistles and things to be able to do everything right, they go by the law of 1/3. 1/3 of the cats, they get euthanized because of how serious it is. 1/3 of them will succumb despite treatment during the hospital stay, and 1/3 of them will survive the event and live on to go another day. Now, if we're in a primary care facility like ours here, where we don't have all the bells and whistles, about 70% of the clients will end up euthanizing them, and of those 30%, less than half of them live more than a week. So it's a pretty dire consequence that we have with heart disease, so it's not always functional. And also, if we do get return of limb function, the body basically has to find new arteries or develop new arteries around the clot, or the clot slowly dissipates on its own to then reperfuse the blood supply to that area. And that can take weeks to months to get function back. So you're dealing with a paralyzed cat for a long period of time. Yeah.
Are these cats less likely to survive because they're already compromised? You know, like if it was a healthy cat that
Right.
had something happen, it might find alternative routes.
Very
But
true.
these
They're
are very sick.
likely to
to begin with.
survive, especially if you, because we already have an abnormal heart, and they already have the tendency to form clots. So even if they survive it, their heart's still abnormal. And even with thromboprophylaxis, preventing blood clot medications, it doesn't prevent all clots from forming. That's why it's private. Plus, it's very expensive to treat. A lot of intense therapy. Usually in a hospital, 2-3 days with intense pain medication and control. Then they go home with pain medications and the thromboprophylactics like clopidogrel for a long period of time. There are a lot of nursing care associated with them. So it's not always because they're so compromised that they get euthanized. It's the either cost or labor intensiveness is prohibitive for some people to pursue. But even still, at the end of the day, you still have a bad heart. Now, if there is an arrhythmia present, or if there's concurrent congestive heart failure present, or if multiple limbs are involved, or some other parts of the body, like the GI tract starts to die away, or the kidneys start to die off, or it's in the brain, those do much worse than clinically. They tend to hard to stabilize the congestive heart failure and the thromboembolic event at the same time. So it is a pretty serious disease. Now, as opposed to it's like a animal that got hit by a car and it's forming clots because there's a lot of trauma, they can heal from the trauma and do well afterwards. So those you can get intense initially and have a good long-term outlook. These guys don't have a good long-term outlook. Any other questions so far? All right, wonderful. Okay, good. Now, stage D heart disease, this is whenever they are either in congestive heart failure, so the building up of fluid somewhere, the lungs or in the body cavities, or they're having repeated episodes of the arterial thromboembolism. A lot of cats don't get to that stage, but if they do, that's called stage D. This is a very difficult stage to manage because they're already at the end stages that can't be controlled very well, and they're already compromised. So this is where you get the really aggressive type of medications, a really potent diuretic, not furosemide, one called torsemide, which is about 4 times more potent than the furosemide. So you use lower doses to get even more dramatic dehydration. It can be hard on the kidneys. You have to be very careful how you titrate the dose for these guys. Multiple other medications that would be involved. A lot of times cardiologists have the expertise to manage these, and their input can be extremely valuable. But at this stage, I usually tell people, we're at the end stages of the heart disease. We're not going to be able to do a whole lot. We can't get the heart function back again. And so we have to really start thinking about quality of life. How far do you want to go? And the goal is not getting the heart stable again like it is in stage C. It's keeping what we can preserve of a quality of life that's acceptable for as long as we can. So it's one of those heart-to-hearts about how long you really want to go once you're in stage D heart disease. Okay. Right now, that's not enough for hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy, and again, restrictive cardiomyopathy is somewhat similar in the way that it affects and what we treat and how we approach things for you with it. So let's just briefly mention a couple of the other forms of the heart disease so you have kind of a working knowledge of what they're all about. First is the dilated cardiomyopathy. Again, this is where the heart muscle becomes very weak and thin, and as a result, it can't hold the blood very well, so it tends to get a large dilated ventricle, and it doesn't have a lot of strength to be able to empty the blood out of the ventricle itself, okay? Now, because of that, we call this a systolic dysfunction. They can't pump blood forward very well, so it is called forward failure or a systolic dysfunction kind of a heart disease. And as the heart gets enlarged, it actually starts to develop valvular disease because the heart gets larger. The two leaflets of that mitral valve we talked about start to separate because the heart walls are getting further and further apart from each other. So you get leakage up through the mitral valve. So then you get backward failure, and then you can get congestive heart failure in the later stages of dilated cardiomyopathy for these guys. Now again, we don't really see this very often. It still does occur. That's not time independent, but it's very rare in cats. So just kind of give you an image of what it looks like. Here you have a normal heart. You see a normal thickened muscle here. With dilated cardiomyopathy, the ventricle gets very weak and thin in the muscle, and so it doesn't have the ability to contract very well. And over time, the leaflets of the mitral valve start to separate, and you can get backward flow up into this left atrium as well. Okay, so that's the dilated cardiomyopathy. Probably not really going to see it because, again, with now we have taurine in all our cat foods. It's something that we don't really see very often for these guys. Okay. All right, now arrhythmogenic cardiomyopathy, there's two names, arrhythmogenic right ventricular dysplasia or arrhythmogenic right ventricular cardiomyopathy. And with the dysplasia, that means that the right ventricle, not the left ventricle that we talked about in dilated cardiomyopathy, but the right ventricle gets to have a decreased function, it gets to be a little bit thin, okay? So it's only the right ventricle though. But because the muscle is abnormal and thin, it tends to trigger abnormal heartbeats from this thing. So you have dysplasia, abnormal formation and development of the right ventricle that leads to arrhythmia. So the arrhythmogenic right ventricular dysplasia / a cardiomyopathy kind of is a continuum with that. And in order to understand how this affects the cats, I'm gonna go, come on, there we go. First, we need to understand how the heart makes a normal contraction. Now, the heart has a very specific electrical pathway through it so that it can contract in a very specific way so that the pumping of the blood results in the full and efficient emptying of the chambers of the heart. So the electrical impulse actually starts up here in the right atrium called the sinoatrial node. It triggers an electrical impulse that travels across both atria so that the atria then contract. Once that impulse gets down here to what's called the atrioventricular node, the node between the atria and the ventricles, then it goes very quickly through what's called the bundle of His, the right and left bundle branches, and down here too, the Purkinje fibers. And then down here at the apex of the heart, it triggers the heart muscle to contract from the apex to the top, so that whenever the ventricles contract, they're squeezing from the bottom of the ventricle to the top of the ventricle, so it squeezes the blood out very efficiently. So we have the heart initiate the heartbeat up here, so the atria contract from the top down to the bottom. And then from here, we have the impulse coming down here from the bottom of the apex up to the top of the heart, so the ventricles can empty. So it has a very efficient pattern. The electrical conduction is very fast through the specialized conduction system. So it's a very quick traverse from this triggering to the atria contracting, and then really quick down here to the ventricles contracting. It's in the order of about 0.01 milliseconds, okay? Or I was sorry, 0.01 seconds, about 10 milliseconds is what it takes to have that travel. So it's pretty quick traversing for this. So this is the normal heart. Now in arrhythmogenic heart disease, we have that electrical impulse start here, not up here. So it's down in the right ventricle. Now because it is usually occurring premature or at an abnormal timing, the ventricle has not yet had enough time to fill, so they actually don't have enough blood in them, so they can't generate enough blood for a good pulse. Plus, whenever the impulse is stimulated here rather than down here, now the ventricles contract from the middle, not the end. okay, not the bottom. So when you can squeeze it from the middle, it's not as efficient of an emptying as it is if you squeeze it from the bottom on up. So you have not only incomplete filling, but also an inefficient pumping, squeezing of the heart. So you have an abnormal pulse on these particular beats. Now, one beat here and there that's like this is not that bad. A lot of these cats can have very multiple ones of them or long strings of them. So there's large periods of time where the heart just can't pump blood very well. This is where you get syncope or even what's called sudden death for these guys, okay? And so those are the main forms of heart disease. I'm not talking about the unclassified because those can be extremely variable and it really needs a cardiologist to both characterize and define and treat. So I didn't really talk about that one very much. But heart disease in cats, as you probably can gather, compared to dogs, it is not a single disease. It's very complex. It's extremely variable in how it can present with these guys and how long it takes to progress to the end stages. Now, cats can actually remain asymptomatic all the way until a very serious decompensation occurs. So they can be in stage B1 and 2 heart disease and we never know it because there's no murmurs, no outward signs, and all of a sudden they form a clot and they go down paralyzed, or all of a sudden they can't breathe and they're struggling to breathe because they got fluid in and or around the lungs and things like that. So they don't have a lot of warning signs like dogs that start breathing a little bit fast and heavy and then they start to decompensate. Cats tend to don't do that. They wait till the end stages before they tell us that they're sick. Heart disease, like in dogs, is not curable in cats, so it is something that is going to eventually claim them, but again, how long it takes is extremely variable. But if we treat them early and aggressively, we can usually, especially for congestive heart failure, have a good quality of life for a fairly decent amount of time. So it's not the diagnosis of doom and gloom because there's a lot of variability to it. Now, if you have arterial thrombal embolism or congestive heart failure with arterial thrombal embolism, not a good of a picture, and so that's a lot more difficult to get them over, and we have to kind of figure out how it's going. Okay. Any questions about anything for anybody? Nobody fell asleep either. I'm really pleased. Any questions from online? All right, wonderful, good. Well, thank you everybody for showing up and doing this. And we'll go and keep you in touch, but we're going to have another one for you guys, okay?
Thank you.
You're welcome,
Awesome.
guys. You're welcome.